All right, first thing we will do for dressing change is we're going to come in, we're going to get the chart, we're going to review it, and we're going to see what type of dressing we need to do on this patient, how we need to clean it, and that'll tell us what type of supplies and stuff we need. Then once I'm done with that, I will wash my hands very thoroughly. Then I'm going to come into the patient's room, knock, 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 come in. Good afternoon, my name is Angela. I'm a student from Bainbridge College, and we have orders to change your dressing. Hi, nice to meet you. Can you tell me your name? Yes, I'm Mary Smith. And can you tell me your date of birth? Great, exactly who I am looking for. Well, how is your pain level today? You're not having any pain? So you don't think you need any pain medicine before we do your dressing? No, I'm good. Okay, great. Well, what I'm going to do is I need to ask you a couple of questions, like are you allergic to anything, specifically iodine or tape? No? I'm okay, no problem. Okay, good. All right, so one of the things that I do is I'm going to pull back and I'm going to look and kind of see, you know, what I see. And I can kind of look from there and see if I've gathered the right supplies that I think I need. I'm going to pull this down just a little bit more so some of our audience can see a little better. Okay. Well, I look and I see kind of how much tape she needs. So one of the first things I do is I go ahead and I tear me off enough tape and I put it right here so when I get to that point I can just pick my tape up and go. Okay. So I'm going to take my bag because we need a moisture-proof bag to put our soiled items in, and I'm going to place it about right there. I'll put it here for video purposes. Okay, so we have provided privacy for her. Is this a comfortable position for you? So I'm going to come along and I need to remove the tape. This is not a sterile procedure here. So I start working to get the tape up. Sometimes it's difficult to get it started. Once I start, I take a finger and I kind of hold back on their skin, kind of pulling against it, and it helps it not tug as much. Then when I get to the end, I fold it over. That way when I let go of it, it doesn't just fall right back down on them. Then I do the next piece and just kind of work my way around. Then I go to the other side, get it off. I'm watching their facial expressions to see if they seem to be in great discomfort. Okay. Sometimes the whole dressing will come right up together. I take it up. At this point, I'm going to look at it. I'm going to assess what type of drainage I have on this and the amount of drainage. Does it look like I have any signs and symptoms of infection going on here or not? At that point, I wad this up. I grab my glove and I like to roll it inside. Then I drop it into my bag. Then I'm going to go back to the sink, wash my hands, and now I'm going to come back. I want to make sure that I'm looking at the wound. I am assessing the edges, the wound bed, if there's drainage coming out of it now, or or it seems to be fine. Then I am going to open up my sterile kit. Okay. You will not always have a dressing change kit. Sometimes you just have to go get the supplies you need. Your 4x4 gauze, your ABD pad, they may just be in little individual packages. So we're going to open up this tray right here. I can get rid of this. Inside this container here is sterile. So at this point, I am going to put on my sterile gloves. Not taking my eyes off my sterile field there. Okay. Now, Miss Colton, could you pick up that piece of paper for me? Because I'm ready to go to the next paper. I just moved the bottom one. Thank you so much. Okay. Now, I need to set up my sterile field. So I am going to pick up this little package thing here, this little placemat as we'll call it. Okay. This is sterile, so I'm sterile, so we're good. Okay. I'm going to lay this down. Remember, my 1-inch margin still stands here. Okay, now, Miss Coleman, could I also get you to pick up this little bottle of saline here for me? If you could pick that up, and if you could open it for me. Take off that seal. Okay. If I could get you just to pour just a smidge into that little bag. Perfect. And now if you will just sit it back down. That is called lipping. Anytime you use a bottle of solution to clean and the bottle has been opened before, you have to lip or pour a little bit of the solution into a trash can or a sink, whatever you are close to. Okay, so we have some extra supplies in here that we're not going to use. There's iodine there. We have gauze. I'm going to take this on out so I can work. We have little forceps or little tweezers. They provided us with some tape. And then we have one ABD pad, which is basically, can be used anywhere on the body, but it's very absorbent. So it's used a lot right after surgery. So, Ms. Coleman, if I could use you again, please. If you could take that little bottle of saline there, and if I could get you to pour me just a little bit into that container.
We got a safety pin.
Huh?
A safety pin.
A safety pin, we can take that out, okay. If you can just, perfect, that's all I need. And you can pour in the amount that you think that you need. Then what I'm going to do is I'm going to take one of my 4x4s. I am going to wet it with my solution. Again, you can pour ever how much in here that you think that you need. You can either hold it with your hand and do it, or you can use the forceps and use it. So ever which way you feel like you have better control of it. I caution you against just taking it and having little strangling edges out to the side and then it's being rubbed on parts of the body that you don't need. But I'll use the forceps. So I told you to go from the dirtiest to the cleanest. So we're going to start in the center. So for purposes of this wound, we're saying it's this little red dot circle here. So I'm going to go to the center. I'm going to wipe it. Okay. Now I'm dropping this in the trash can. I'm actually done with these forceps at this time, so I can drop them back in there. I cannot put them back on my sterile field because I've now used them on this patient. If I put them back on my sterile field, I have broken sterile field. Now, I'm going to take another gauze, and I need to dry it. I am going to dry it in the same motion that I cleaned it in, from dirtiest to cleanest. So, but we are just going to pat this dry. No friction, just the pat. Then I will drop that in there. If I had another gauze, I would simply place it right on top. Then I would place my ABD pad on top of that. Now our wound is covered. At this point, I probably would change glove, take these off and just put me on a pair of clean gloves. And then I would tape this down. If I haven't torn my tape long enough, that's okay. We can get this secured, and then we can tear off some more tape. Here. I do not put excessive tape on this. This does not have to be fully taped. We just want it to stay on them. If it's down here and it's going to get in their pubic hair, I am not putting tape there. That is torture to someone to be pulled off. So I do this. Then, in addition to that, I would take a Sharpie, not a regular writing pen, but a Sharpie. I would write on there the date, the time, and my initials. That lets the next nurse know if she comes up to change the dressing change. Let's say the dressing is due Q shift or every shift to be changed, and day shift just did it at 2 o'clock and 3:11 comes on and it's 3:30 and she wants to go down and do her Q shift dressing change. It's not going to do a whole lot of good for her to go and change that dressing an hour and a half later. So that will alert her to know, hey, I need to wait till later in the shift to change this dressing change. So after that point, then I will, remove my gloves. Then when I got to a sink, I would regularly wash my hands with soap and water, and I would go document. I would ask her, how is she feeling? Oh, I'm in pain now. Okay, ma'am, I'll get you some pain medication. Let me see what you can have. The end.
I have a question.